Hi, I'm Dr. Lori Pasternak. Having your pet's leg amputated is a very scary thing. We at Helping Hands understand how scary it can be, so we're producing this video to help take away some of that fear. Pets have no vanity. They don't care what they look like. They only care that they're loved. And I think people have a harder time adjusting to their pet's amputation than the pets do. Three-legged pets live happy lives with minimal adjustment. There are several different reasons a pet may need to have a leg amputated. Birth defects, neurologic disease, or most commonly cancer or trauma to the leg. Generally, amputation offers immediate pain relief, as post-surgical pain pales in comparison to the pain of leg cancer or trauma to the leg. It's been shown that the size of the pet doesn't affect recovery. All sizes of pets can recover well, go on to live happy lives even after having a leg amputated. Most pets are up and walking within 12 to 24 hours of surgery with little to no assistance. If your pet's overweight, weight loss will help reduce the strain on the remaining joints that now support your pet. A trim body condition is healthier for your pet, regardless of how many legs they have. Immediately after amputation surgery, it's very normal for there to be swelling and a lot of bruising around the incision site. We are always so happy when they feel great after surgery and want to move around, but the more active they are immediately after surgery, the more swelling and bruising may occur. So remember, they've had major surgery and rest is very important. Please don't allow your pet to overdo it in the first week after surgery, even if they feel up to it. Front leg amputations often will be bandaged to collect any possible drainage. Hind leg amputations cannot easily be bandaged, so you may see some of this drainage from the incision for the first few days. The amount of drainage can be minimized by keeping your pet calm and quiet. The easiest way to keep them calm and quiet is to put them in a well-padded crate. No matter where they rest, please be sure it's well padded for their comfort. If you see drainage from the incision, a warm, moist washcloth can be used to keep the area clean. Sometimes we place sutures in the skin. Sometimes we're able to bury them under the skin. Your discharge instructions will tell you if the sutures need to be removed, but usually if you can see them, then they need to be removed in 2 weeks. If you don't see them, they're under the skin and they'll dissolve on their own. When you get your pet home, they'll need supervision and support until they can walk on their own. For some pets, this will happen right away, and others may need support for a few days. Stairs may be challenging at first, so please be sure they're supervised until they can go up and down with confidence. Smooth floors also may pose a challenge, so rugs and runners with non-skid pads can be super helpful to your pet. Also, keeping their nails clipped short can help prevent slippage. If extra support is needed, you can purchase a sling that is made to fit your pet's size. You can also improvise by using a towel or cutting up a canvas shopping bag with handles. For front leg amputees, sling it under their chest, and for rear leg amputees, place the sling under their belly. Be sure that you stand on the same side as the amputation to act as a counterweight when helping them with the sling. Your pet will have to adjust how they use the potty by learning to balance a little bit differently. They'll figure this out quickly, but it may take a few days before you see a bowel movement, as they may hold it for as long as possible. Don't worry, they'll move their bowels when they're ready. Rest is important for the first few days as their incision heals, but after a few days, getting them up and moving slowly is good for them so that their muscles stay strong. Other pets may not understand what happened, and they may try to play a little too rough, so keep your amputee away from other well-meaning pets until they're healed. You can allow them to return to full function after a week or two if they can get around on their own with confidence. If your pet enjoys the water, swimming is great physical therapy. If you need more information or want to learn more from owners who've been through the experience of a pet's amputation, there's an online community that is devoted to amputee pets. Tripods.com is a community-supported website for sharing stories and learning about amputations and bone cancer care for pets. We're so sorry that your pet may need an amputation, but at least we can help you get through surgery safely and affordably. Surgery and dentistry are the two most expensive procedures you may be faced with as a pet owner. Having to choose between paying your bills or providing these services for your best friend is a choice no one should have to make. We at Helping Hands have developed a way to bring down the cost of these procedures to an affordable amount. We wish we could do it for free, but until we win the lottery, we have to at least charge what it costs us. Why do we do it? We do it because we never want to see a pet suffer or be euthanized simply due to financial constraints. We are here to be your helping hand.